Healthcare-associated infection, a problematic that should concern us all. Hi, my name is Elizabeth Hodges, and I'll be presenting this workshop to all our healthcare providers. Let's get started. Question: what is a healthcare-associated infection? The acronym is HCAI. Well, an associated infection, it's also known as a pathogenic microorganism. It is an infection occurring in a patient during the process of care in a hospital or other healthcare facility. So, rates or estimated rates of infections are worldwide. 5 to 10% patients acquire one or more infections. This is in modern health care facilities in the developed world. But now, in developing countries, the risk of infection is 2 to 20 times higher than developed countries, and the proportion of patients affected by these infections can exceed 25%. These organisms are transferred to various types of surfaces. Another question is, what is the cause of dirty hands? What is the cause of no washing hands? Infections can cause more serious illness, long-term disability, excess deaths, prolongation of stay in the hospital, and additional financial burden for patients and their families. Here we have some sites with higher risk of infections. We have 30%, 34% in urinary tract infections, and 13% lower respiratory tract infections, with a 14% in blood infections and 17% in surgical site infections. And these infections are happening because of the lack of hand hygiene. How can we as healthcare providers or workers help to reduce these infections? We know that any healthcare worker should be concerned about hand hygiene. So you need to protect the patients and protect yourself. Protect the patient against harmful germs carried on your hands or present on his or her own skin, and protect yourself and the healthcare environment from harmful germs. Proper hand hygiene can reduce infections by 40%. Now, you may be wondering, when should I wash my hands? It can be pretty obvious, but let's review these steps. Not the steps, but the occasions. So 1, before touching a patient. Number 2, before clean aseptic procedure. 4, 3, let's not skip the number, after blood fluid exposure risk. 4, after touching a patient. And 5, after touching patient's surroundings. And we know that hand washing is very important, right? So how are we going to do this? So let's follow the protocol. Let's watch this video and we'll go through all these 11 steps.
To perform an effective hand hygiene, first of all turn on the tap to the temperature that is comfortable for you. Then wet your hands on all surfaces. Next, apply soap and clean the palms of your hands, which is the most heavily contaminated surface. Then clean the backs of your hands with your fingers spread so the surface in between your fingers is also cleaned. Then clean the inside of the fingers by spreading your fingers on the palm side. Next, clean the tips of your fingers by putting them inside the palm of the opposite hand. And clean each thumb in the palm of the opposite hand. And then clean the palms of each hand using the fingers of the opposite hand. And finally, clean the wrists. Now rinse off all the soap from your hands. And turn off the taps either using your elbow or a clean paper towel, and dry your hands thoroughly.
Let's not forget that this process must last at least 40 to 60 seconds. Okay, let's continue. Why do some healthcare providers don't comply with the hand washing protocol? Well, there could be many reasons, but some of the reasons that I have heard is that they're too busy, their skin irritation after many hand washing, glove use, forgetfulness, or lack of information. The major obstacle for hand hygiene is the short time frame. Adequate hand washing with water and soap requires 40 to 60 seconds. But in average, time usually adopted by healthcare workers is less than 10 seconds. So let's be part of the solution and reduce transmission of pathogenic microorganisms. Wash hands and save lives. And please visit cdc.org for more information. And once again, thank you for listening.